Several thousand people have died since late last year, and thousands more are infected by the bacterial disease, which is transmitted through contaminated food or water. UN agencies have recorded more than 200,000 infections in 13 African countries since the outbreak began, as well as over 3,000 deaths. January alone saw 6,000 new cases and 355 deaths in 9 countries. The outbreak has been described as the worst in years. We're now joined by Patrick Otim, Health Emergency Officer and the Regional Incident Manager for Cholera Response at the WHO. He is based in Brazzaville, Congo Republic. Thank you so much for joining us, Patrick. How worrying is the cholera outbreak in Southern Africa, and have governments, do you believe, done enough to control the spread?
Thank you very much, Anna, for the question, and good evening, viewers. So the cholera situation within the Southern Africa sub-region is worrying, basically from 3 factors. One is a number of the outbreaks have been going on for a very long time, started last year, and so it's taking more than the time that we had anticipated to be able to control this. The second one is the issue of the deaths that we are seeing. We are seeing high case fatalities happening. Usually for cholera outbreaks, WHO recommends that we should keep the case fatality ratio, that is the proportion of the sick people who die, below 1%. But in some countries now it's around 4%, and that's very, very big concern. The third issue is also we are seeing a lot of cross-border spread. So because of the high population movement among the countries, so you find that the outbreak is moving from one country to the other, and it's a big point of concern that requires all the countries within the sub-region to come and work together. And I'm glad the presidents were meeting today and have made very concrete recommendations to be able to address that. Now, on the second part of your question, throughout the 2023 and the early parts of this year, all the countries, the 8 in SADC that had cholera outbreaks last year and the 5 that currently have active cholera outbreaks, the governments have been working very, very hard across the domains of cholera response pillars, trying to increase access to safe water and hygiene and sanitation facilities, addressing hygiene promotion, and implementing public health measures that address waste management and disposal, and also trying to increase community awareness, increasing access to treatment. A number of facilities have been set up. So they have done a lot of work. However, as the heads of state also acknowledged, there is need to do more, particularly in the area of increasing access to safe water and sanitation, which is the major driver of the cholera outbreak that we are seeing.